So my presentation is about Cushing's disease, and what causes Cushing's, I think, is probably one of the first things we ask, and the disease is the result of an enlargement of a benign tumor in a portion of the pituitary called the pars intermedia. I think I said that right. The correct term is pituitary pars intermedia dysfunction, or PPID. It is not clear at this time what triggers this conversion of cells, but it is on the pituitary gland, and it does. It secretes ACHT, which is a hormone that controls the production of cortisol. With PPID, the cortisol levels are elevated. Cortisol is responsible for healthy physiological responses, such as the fight and fight, helps maintain normal blood glucose, a regulator of the immune system. It also helps with liver detoxification. Affected horses might be generally predisposed, have pre-existing conditions such as EMS, or simply undergo more wear and tear over time. Environmental factors may play a part in this. Diet could play a role. They don't really have the exact reason why, but they do know that it is caused by the enlargement of the pars intermedia. EMS is also a metabolic efficiency issue with insulin resistance, two separate diseases. What are the symptoms? The signs and symptoms of Cushing's have a very slow onset. The disease is seen predominantly in horses in the 19-plus age range. According to Grant Miller, DMV, on aging horses, their joints become stiff and strides short. Everything takes longer, warming up, cooling down, shedding out, and getting fit and becoming sound. Where there was once muscle, there now is not. But because this happens slowly, we assume these are normal signs of aging. Or are they? Some clinical signs to help with the diagnosis are there's a delayed shedding. There is also long wavy hair coat. That's more of an advanced symptom. Can have chronic laminitis, muscle loss and fat accumulation, excessive drinking and urine, or ravenous appetite, or impaired wound healing, and a pot-bellied appearance. Not all the signs need to be present for a horse to have PPID. There are horses who have no outward signs. How do you test for this? Accurate testings for Cushing's can depend on the time of year this test is done. Late summer and autumn tests can result in a false positive result. The ACTH levels are normally higher at this time of year. So according to the South Shore Equine Clinic and Diagnostic Center, a single blood sample may be all that is needed to detect the elevated ACTH level and is diagnostic for PPID. The daily levels of ACTH can vary throughout the day, and if the test is negative but PPID is suspected, then a TRH response test is ordered. This is done by a blood sample, and then a second blood sample is drawn 10 minutes later, and the ACTH is measured in each sample, and a threefold increase is the diagnostic for PPID. And what is the treatment for Cushing's? There is not a cure for Cushing's. The first drug tried was bromocriptine. I can't even say the word, but it had to be injected subcutaneously several times a day. Another drug, cypropenidine, I'm not very good at these names, works, but then it was losing its effectiveness. The only reliable medication on the market now is Pergoloid, and it comes as a Prosend. Pergoloid works only by mimicking the action of the dopamine and inhibiting the hormone production within the pars intermedia, and thereby lowering circulating ACTH and other hormone levels. Prosend is administered in pill form and can be diluted in water and promptly syringed into their mouth, or it can be hidden in a treat. It can also just be put in their food. The pills are small and easy to administer. The starting dosage is between 0.5 and 1 mg per day for an average adult size horse. This drug was withdrawn from the human market in 2007 because of concerns over heart valve and lung fibrosis. There have been no known similar problems in horses. The side effects of this drug can be depression, loss of appetite, and they are usually temporary, and some vets actually start with a 0.25 dose per day for 3 days and gradually increase by 0.25 every 3 days. This has led to less side effects at the start of the medication. According to the ECIR, which is the Equine Cushing's and Insulin Resistance Group, at this time there are no homeopathic remedies currently recommended or suggested by the ECIR group. Symptoms should be monitored on a daily basis to see if additional information is needed, and a new ACTH test can always be run again to see if there is higher dosage needed for the horse. Living with this disease. According to Mindy Price, who is the owner of Montrevel Equine Training Center, she quoted, "We have over 30 horses currently with us, many in the 15-plus age group. 4 have EMS without Cushing's, and 2 have Cushing's, ages 23 and 23 without EMS. Mindy states that she rarely sees the two diseases together, although they can be. With proper care and medication, these horses are living normal lives. The 23-year-old with Cushing's is also a lesson horse, and she went to nationals 2 years ago and won, so easily can be medicated. Cushing's researchers recommend supportive care and routine vet examinations. Items such as clipping excess hair, examination for any wounds or infections, routine vet visits, dental care, and a good worming schedule is important. As far as the nutrition goes, it is recommended to feed a low-carbohydrate diet with a ration balancer as a supplement. There is no reason for a horse with Cushing's with proper medication and care to have the quality of life as any other aging horse would have." There is some new research that was kind of exciting to come across. This is from the College of Veterinary Medicine at the University of Minnesota, newly funded, pinpointing a genetic cause for PPID in horses. This is from April 6 of 2021. There's a team of researchers led by Molly McHugh. She's the Associate Dean for Research and professor in the Department of Veterinary Population Medicine. She recently received a nearly $60,000 grant from the Morris Animal Foundation to investigate the genetic risks for equine pituitary pars intermedia dysfunction, or PPID. It can be difficult to identify PPID in a horse until clinical signs become apparent, including chronic infections or laminitis, and the disease may already have been present for months to years before a diagnosis is actually done. By that time, treatment cannot reverse all the clinical effects. So researchers must help establish early diagnostic strategies for veterinarians to get and stay one step ahead of PPID in their patients. The research team used whole genome sequencing to identify hundreds of PPID risk Elliots, I think they're called, in a cohort of 36 horses. Scientists now are going to validate these in a larger cohort of well-phenotyped horses to establish the significance and differences in these frequencies. This funding began in March 1st of 2021 and goes through March 1st of 2023. So this is new research that'll be really interesting to see where it goes. So in conclusion on all of this, Cushing's is usually found in horses 19 plus years of age. And by watching the changes in your horse and knowing the signs of Cushing's, a vet can confirm the diagnosis, and medication is available to help the horse live a moderately normal life. Hopefully, this new research on this disease will lead to a routine, systematic testing of this disease at an earlier age and make it even better to live with. And it was kind of interesting. The purpose of my research in this disease was to learn what it is, how it impacts the horse, and what can be done to better diagnose it. I had a Tennessee Walker who was 19 and had a late diagnosis of Cushing's. He had EMS as well and was on a strict diet and exercise program, but reoccurring laminitis made the exercise difficult. It was interesting to learn in the research that they are two very different diseases. I assumed that they always went together. But with proper early diagnosis and medication, he might have had a better quality of life. And I now have such a better understanding of what Cushing's is and how it affects the horse. I also have a horse onboarded at our facility here at our farm that does have Cushing's. And I'd like to share a little video of that with you so you can really see what this disease does look like. This has been a fun project to put together, and I've really enjoyed doing it. Thank you.